This was our seminar. We met once a week. This man is an internist specializing in allergy. This is an internist. This is a psychiatrist. And this is the other psychiatrist. This is a surgeon. And this man beside me is an internist who specializes in gastroenterology.
Who wants to report on a patient? Dr. Patrick, go ahead.
Do you want me to report?
I think you better start off.
All right. This is a young lady. I received a phone call in my office one afternoon from her husband, and he said that she had to be seen immediately because she was in severe pain, and that if she didn't have someone to speak to, that she was going to have a nervous breakdown. She has 2 children. They're 2 years old and 6 months old. She told me that after her first baby, she developed a pelvic infection, and she didn't get over it when she became pregnant again, and again after her second delivery, she developed another infection. She had high fever, lower abdominal pain, and back pain. She was treated for this, and she didn't seem to be getting anywhere. So she consulted with a gynecologist who confirmed the original diagnosis and treatment, and that was the end of that. I saw her twice, actually. The first time I saw her, I listened to her and her complaints, and I agreed with her that although she's had physical complaints, and she has physical pain without any doubt, that her main problem now was on an emotional level.
Just about 6 months ago, everything started to collapse. I was very weak. I even when I prepare a meal now, after I've prepared it, I can't eat it. I shake terribly. I have to lie down. And I scream at the kids, of course, and cry an awful lot. And I give my husband a bad time. The minute he comes in, I have the supper ready. I have to go and lie down after it. He has to take care of the children. It's threatening our marriage because things have got very, very bad. Mm-hmm. We quarrel terribly, and when I wake up, I'm exhausted. I pull myself out of bed. Mm-hmm. I feel I just want to lie there and sleep and let someone else do everything. In the past week, I have eaten better, but for about 2 months, I ate practically nothing. I couldn't get the food down. If I tried to eat in the morning at breakfast, sometimes I threw it up, or I felt very sick.
And when you had the pain, like when you came to see me, you said that you could stand the pain, but the pain is something that you were willing to tolerate.
Oh, yes. I've had it for so long that unless it's almost unbearable, I can do my work and everything with it. Mm-hmm. I've got now that I know what movements I can make without aggravating it. I know how to bend without hurting myself.
Yeah.
And the pain I can take, but this nervous trouble, it beats me. I can't take this much longer. Mm-hmm. After the first baby was born, I got slight infection, and my health went down. I wasn't very good physically. Then we had a series of bad luck. My father took cancer, and I nursed him for a while. Then after his second operation, he went into hospital, and he died there.
Your father died how long ago now?
Last March. When he died, I really didn't feel very much until my baby was born. And then suddenly, it was just as if he had died then, instead of a few months previous. And I would get these awful nightmares, and I went through every pain with him, over and over again. I thought I'd go mad. I kept seeing his face and seeing him in the pain, and I'd go through it, and it used to haunt me, but not anymore. I'm over that now. I always found a reason for feeling the way I did, until the past few months, when there really was no reason. Then it began to worry me, because our financial troubles and all our illnesses were behind us.
Did you feel very bad that day, particularly bad that day, when your husband called?
I had this slip disc, and it was paining me and getting me down. I barely slept at all, maybe an hour each night. I would get to sleep about 6 in the morning, and of course I was up at 7. And that was bad enough, but I felt very weak. I thought I'd gone on so long that I'd never find someone to help me, that there was something wrong with my mind that no one understood and no one could do anything about. So I had this hopelessness that I'd always be this way. You definitely get sorry for yourself. I mean, I was getting a martyr complex. I felt like everyone was down on me, and I was carrying all the burden and whatnot, and that I was living a worse life than anyone else, which is ridiculous. But you get to feeling that way, and then you get worse. You get in a horrible condition then. And I don't get out very much. I think that's a lot to do with it. Sometimes if you have friends near you, you can go out and take your mind off things. I can't control my 2-year-old. I can't control her. It's impossible. And I feel it's because I just don't have enough willpower to do it. I don't have the strength of mind to stick it out. She knows my weaknesses, and she knows how far she can push me, and then I have to give in. I feel so defeated. And weekends I mostly spent lying down. I'd stay in the bedroom in bed. Often in the mornings when I look ahead at the day that's ahead of me, I have a lot of work. I have a lot of things to do and a lot of things to take care of. Well, I get in a panic. I think, I can't do it all. I'll never be able to manage it all by myself. I've even, when there's been snow in the ground, I've been outside the building and I didn't even know I'd gone out. I'm out there with my apron and slippers on in the snow. Something sort of makes you want to run away from it all.
And it has to have a physical outlet then, does it?
Yes. Walking or working at something. Like sometimes I start to scrub away at the floor or something, and if you don't do something like that, if I didn't do something like that, I ended up pulling my hair or pounding on a wall or shredding a handkerchief, ripping it into pieces. Well, I'll tell you what I felt a lot. I felt like I had no feeling. I sort of sometimes felt I was just a body doing everyday things, but there was no feeling in me. I couldn't feel anything. I couldn't sort of feel love for the children or my husband. When I looked at them and played with my children, I didn't feel any love for them, and yet I didn't hate them. I just felt nothing. And when you talk to anyone about nerves, you say, oh, my nerves bother me or something like that, I find the average person seems to think that you should be able to pull yourself out of it by yourself. You think, oh, well, you just have to pull yourself out of that depression, look on the brighter side of things. And I found that I would go to bed at night and I'd vow to myself that the next day would be different, that I wouldn't get upset and I wouldn't let things bother me, and I wouldn't be depressed. And the next day comes and a couple of things go wrong and you're right back where you started, and then you feel such a failure.
How did your husband react to these things?
He couldn't understand it. Well, I don't think anyone could, apart from someone in the medical profession like yourself.
This girl just hasn't had an opportunity to speak to anyone. She had been treated strictly on a physical basis.
Well, her reaction, her depression, her anger, and all these other things that we've heard about are not necessarily in keeping with her physical condition.
It's going to be very difficult. Sure, there is enough there which is obviously emotional in background and depression in content, if you wish. There's also a fair amount of physical trouble here, and she has also had a fair amount of reality trouble, hasn't she? And certainly, this is the kind of situation where it seems to me you have a heck of a job selling first emotions until the average doc smoking his pipe sitting back there and saying, what are you fellas trying to do?
Yeah.
This girl has some problems here. Let's sort out the physical problems first. And she has some physical problems. They're real ones.
No, well, I'm not to say that we ignore it. But
well,
these things are being
It's
investigated.
assumed that our seminar is based on discussing the emotional side. The two investigations can go on together. I don't think that one rules out the other.
There's no problem of investigating this woman physically. I have no difficulty at all. If I can't do it, I can always find someone who can help me with it. The question of her emotional aspect is much more difficult to treat.
If it were my own situation, I would feel that this patient had reached the point with these number of problems and a depression that she should be referred to a psychiatrist, and I would tell her so.
A good proportion of the practice that he will get and that I will get and that Dr. Miller will get certainly, and I'm sure you do,
And myself.
And yourself, is psychiatric. And a good proportion of this needs some kind of care. It seems quite obvious at the outset that all these people cannot get properly and adequately trained psychiatric care, so that we ought to consider it our responsibility, certainly as far as today's developments of medicine are concerned, to handle much of this ourselves to the best of our ability. Because, to be corny, I want to help people. And I can't help them all by saying to everyone that seems disturbed, you'd better see a psychiatrist.
Oh, but wait, Michael, I haven't said that this is what we would do with every patient. Dr. Snarch has already gone through this patient for 3 days and has brought out some very intricate psychological problem. This is quite a different matter from the patient who comes in and says, Doctor, I have a pain in my neck.
Yeah, but how about those that are not pounding the table and are pounding the insides of their stomachs or their chests?
Or they feel their heart pounding, or they feel their stomach turning over.
Now here, obviously, you're entering into a very important area, and that is the doctor's attitude to what the patient's emotional mood should be in relationship to a physical complaint. We'll look at her mood, and we'll look at 3 areas of her life. The area of work, the area of play, and the area of love. Always keeping in mind that life is dependent upon object relationships. If this patient has adequate facilities to function with, then this depression which she is now feeling, which is a reaction to something which we can put our finger on, will be able to be removed by anyone. By anyone meaning by a medical man.
But I can't see, a brief approach as a family doctor unless you can find a conflict in life now. Help her to see that if something in her life now is troubling her and that it is too painful for her to face it. And in this way, I think it will help her to bring it out to a more of a focus.
Do you feel anyone is sort of working against you? Do you feel that?
I have to explain this to you. This cousin of mine in Montreal, she's a very wonderful person. And she's one of the few people I know who can do anything. She's a perfect wife and the perfect mother. And she really is. I really mean this. And my husband has a great deal of regard for her. My husband's mother, my mother-in-law, was also that type of person. I think I'm trying to be the perfect housewife and mother like my cousin is, but I just can't be it.
Do you wish then that your husband were different?
Well, nobody's perfect. I mean, I think maybe I wish that he'd give me more credit for the few things that I do well. I mean, there are some things that I do well. I'm a good cook. I've worked hard at that.
When you first met him and when you were engaged, did you have the impression also then that he was more or less a fellow who likes things just so?
Well, as I said to you once before, our backgrounds were so different. Now, I was brought up sort of rough and ready. And I hadn't been taught all the best manners. And when we first met and when we got engaged in that, when I was with him and his family, I did feel very inferior because I'd led a completely different life from them. My worry when I was young wasn't my manners, it was getting enough food to eat and things like that. But, but since I did meet him, I've, tried to learn how to do things properly and do things the way they should be done.
The way he does them.
From the point of view of the doctor trying to help the functionally sick person, is it important for him to attach an exact label to decide that this is depression or another form of anxiety?
Like all groupings, both anxiety and depression are an expression or lack of expression, if you like, of some feeling tone. And there's one group at one end in which the anxiety is quite apparent. You don't have to have anyone tell you that it's an anxiety. And the other group where it's a depression. But in many instances, you'll find a combination of anxiety and depression. On a deep level, the spring well of the feelings is really the same. I think that one of the things that one has to keep one's ears open for is that in anxiety one has to have a feeling of fear coming through from the patient, whereas with depression, in one way or another, a feeling of sadness will come through from the patient. I think that...
You mean the doctor will get a feeling of sadness?
Yes, he'll pick up. And I think that he can go very nicely by what he picks up as to whether he's going to call this anxiety or depression.
The impression I'm getting is that you are spending some of your time in treating this patient and understanding how you are reacting to this patient, and that this may be of some importance in the treatment of the patient. This is the point that I think I'm getting out of what you say.
Yes,
we're not trying to measure his countertransference.
Yes.
Well, in a sense, yes, as the measure of his interchange with the patient. But maybe you'll go ahead and we'll see what comes out of it.
Fine. Well, I saw this young lady again a week ago. She said she felt a hell of a lot better, that she didn't need any pills, she was sleeping without any sedation, and that things were wonderful, And she was getting...
cured then, eh?
Yeah, I've got her cured.
Well, did you believe it?
Now, I'll just go on. Now, she said also that she'd, for the first time since she's married, she was able to talk to her husband freely and tell him how she felt, and that they both felt better for it. Now, what got me is this. No, I didn't believe it. I think, though, that perhaps 4 years ago, when I wasn't interested in any of the emotional aspects of illness, I was just simply interested in finding out whether there was organic disease or not, I would have been very happy at this stage.
Sent her off.
And I sent her off and felt, gee, I've done a terrific job. This is good. I'd spend the rest of the time telling her what kind of a good doctor I was. That sort of thing. Now, I don't have to convince you.
Once you start converting her to the emotional field, what, is going on between her and her husband, whatever problems in life, the symptoms tend to disappear as the emotions get brought out and expressed more freely.
Now, the thing about it, though, of course, this was unrealistic. And I thought that, of course, that we have to go on. The other thing, though, I felt is that there was some resentment, I think, on part of the patient to go on. It was obvious that she was blocking me, that she wasn't volunteering any more information. In other words, I'm feeling fine. Let me get out of this. I had to ask some questions in order to get information from her. The first statement she makes when she comes in is everything is wonderful. I don't need anything. We're getting along fine. And the last statement of the session is, I know something has to be done because this marriage is going to break up.
The marriage is at the point of breaking.
Is it our business to break up marriages?
Well, that's of course one of the fears.
This is one of the fears.
That's the fear there.
Yeah,
But it seems to me that once you start expressing your resentment, I mean, the whole idea is not just to get her to explode with her husband. I don't think it's any solution. It seems to me in the long run, we want to help her and her husband, both of them, to be able to be more open, more frank, and not to get into these messes where they're mad at each other. But this is the whole idea, I think, in the long run is they may go through storms in treatment, it often happens, but in the end result is that they don't get angry at one another because they're telling each other what they feel. I mean, you replace anger and frustration by self-expression.
Well, I was a little, and I am a little fearful about going on, and perhaps I recognize that there's a lot of hostility here and a lot of anger on the part of the patient.
You finally come to the point where the physician has to look into his own feelings and use them in order to understand the patient.
You know, we have our sessions, and then we get together in a group, and some of the other doctors have their patients as well, and then we discuss common problems.
Yes.
And, of course, this has been going on now for a number of weeks, and as well as me getting to know you, they've gotten to know you from me.
Yes, I get a lot of attention.
You're getting a lot of attention. And some of the feeling that they expressed to me was that there is a hold back, that there seems to be. And probably not conscious on your part.
It's not.
I'm sure it's not.
I've been thinking about this myself too, And, in the past couple of weeks, I've said things that I didn't realize I felt before.
Yeah.
I think it's because I haven't never expressed it before. And it's just that either I don't know how to put it into words, or I just haven't got down to the depth of what I feel yet.
How do you feel toward your husband? How do you feel inside of you?
My husband's a great teaser.
In what way?
He teases terribly, and practical joker. And he never stops, and I do have this feeling every time he upsets me. I mean, there's been times when I've thought, if I had a knife in my hand, I'm sure I'd put it right in you.
Yeah.
I hate you so much for doing this to me. I can't say what I want to say, but I just don't say anything at all.
What did you feel like telling him that you didn't tell him?
I felt like telling him to go to hell.
Yeah.
I do most of the time feel like saying that. But I'm just not the type to say it. I just can't speak to people like that.
You've been angry for so long.
Yes.
And why do you pound at the wall?
Well, I know I've got to take it out in something, so rather the walls and me than the kids. I'm always afraid that I will hurt them. I mean, there have been times when when the 2-year-old deserved a good smacking.
Yeah.
And I'm afraid to start giving it to her, you see, but when I have done it, I forget when to stop. I forget that it's scale there. It's just something. I've just got to keep hitting. I've just got to fight back at something. Just have to take it out on something.
And you can't take it out on your husband, can you?
I don't know how to fight back. Nothing affects him. Even when I said I was going to leave him, it didn't seem to affect him. He just said, all right. Maybe it's better all around.
Do you think you really wanted to go, or you were sort of just testing him out?
I think maybe I just wanted him to tell me how much he wanted me to stay.
And it didn't work?
No. I don't understand him.
But I think you have to understand yourself.
I don't even understand myself.
I know you don't. You see, you may be able to react in a much more effective way if you did understand yourself. And like the patient who has an ulcer, you have a depression. It's you who has a depression, not your husband. Do you understand?
Yes.
Do you get the impression that he's a skunk?
The impression I get is that he's a skunk.
Sure, we're not concerned with whether he's a skunk or not. She
Well,
just
sure
uses
would
everything to, well, not so much. She's using everything to show how bad she is and how inferior she is. And now she's saying it's he who's teasing me. And all that's doing is reinforcing her own feeling that she's not worth very much.
How she made him into this hateful beast.
How did she make him into this? Or was he always like this? I don't know.
But what's the percentage from her that makes him this kind of guy?
Mm-hmm.
In other words, surely they both love one another too, and that's not there right now. She's so angry she can't see it. But she must contribute to this in some way too. And this hurts even more.
Maybe his only weapon then is the teasing. Maybe this is part of their interchange.
To keep his manliness.
To keep his manliness, yes.
What did you think after you left the session here last time? Or what did you feel?
I just kept thinking about, you know, what I'd been saying about my husband, you know, and about him upsetting me and everything.
Do you think that you could be upsetting your husband?
He says I do.
He says you do. Well, do you think you're consciously sort of pushing him away, or?
I think I do, because I don't like him to, you know, even when we're sitting watching television, I don't like him to put his arms around me or kiss me or anything. I don't like that with him anymore. When I first got the infection, I thought it was because of that. But I mean, there's really no reason for it now. I mean, there's very little, if any, infection in me now, and physically I'm good. But there just isn't any sexual feeling.
And that's gone on for 2 years.
Since the first one was born, just over 2 years now. I mean, I haven't said to my husband as much as I've said to you. In fact, he'd hate to think I was talking about it. To him, it's a very important thing, you know, and... But anyway...
It's an important thing to all of us.
Except me.
I think it's important to you.
Should be. I mean, I've heard of frigid women, but... I really take the cake. If there's a physical reason for it, tell me, please.
Be so simple again. You'd like to have a simple way out.
Sure I would.
So would I, but there isn't. What is it that you're doing, possibly you're doing, that's making him behave the way he is? And not only him, but perhaps any man, because I've reacted the same way.
Yes.
You know? And I'm just thinking whether it isn't, for one thing, this feeling that you have of inferiority. And I don't know how you're showing it to him, like you've been showing it openly to me here, to the point where at the beginning you're sympathetic and understanding, but after a while it gets to be annoying.
Sure, I know that.
And I think to myself, why the hell does she keep feeling like
That's
this?
right. Well, that's the way Gordon feels.
Does he?
I know he does.
What do you mean?
Well, I know it annoys him if I say to him, I can't do anything right, I don't do anything right. Then he doesn't want to be sympathetic towards me, he just gets angry with me. I know that we could both be happier if I had the confidence in myself to stick up for myself. Now, I know that would really smooth out a lot of difficulties. if I could just get a confidence in myself, Gordon would be much happier, because no one wants to be tied to a person who feels that they're hopeless. Just as you said, at first you can be sympathetic, but then you become damned annoyed with them. Well, naturally, I can see that.
That's right. Well, she felt much better at the end of the interview. She felt that she had last saw some light. She felt as though she had some insight into herself.
The type of treatment we've spent so much time on is really not the only treatment available. It isn't the only approach.
Is drug therapy alone ever satisfactory?
If you decide to treat a patient with drugs, that's your decision, and you've made the decision on the basis of the presenting facts and factors. You can handle them or you can't handle them, and so on. Or you may decide, well, this patient can use some drug and psychotherapeutic intervention, and you use both, and you get along fine. Or else you decide that perhaps I will try psychotherapy only. So you have three choices.
Do these drugs have a specific effect against this depression, just like penicillin might have a specific effect against a certain sensitive organism? But I don't think as doctors we should prevent the use of specific therapy.
I think we have to make it quite clear that depression is both a symptom and a disease. And if you're going to indiscriminately treat depression like a symptom, then you're giving this drug like a cough medicine. There are drugs that specifically affect depression. Depressions as symptoms and depressions as diseases. Certainly we know of certain depressions that are so deep-rooted that one looks upon them almost as physically developed, where these drugs have a very specific effect, primarily because you do not seem to be able to get in touch with the person. You're always in touch with the depression, but never with the person.
Here I think we must state, for instance, a suicidal patient must be taken seriously. One must, because they talk about it, there was once a statement made, used to be held, that if somebody said they wanted to commit suicide, that they wouldn't. But this is not true.
Now we feel that there's a large group of individuals who can be treated psychotherapeutically by non-psychiatric physicians in the way in which we have attempted to deal with here and dealt with successfully. If in the process of a period of time you find that this patient wants something from you, and what they want from you is words, but you can also give them drugs, then the drugs, in a sense, becomes not only a help in themselves, but also becomes a substitute for giving something. And if you're going to carry this patient over a long period of time, drugs will be very useful. If you can't expend the time, if you are not willing to deal with the patient, and in some instances where the personality is so rigid that even the most expert of psychiatrists will not make too much of a dent in the patient's personality.
And how about sleeping at night? Do you take the little capsule?
Oh, no. I only took the one prescription of those.
You haven't taken any?
I haven't had those, I guess, about 3 weeks.
Good.
I've had good days, and my evenings I've enjoyed. So I've gone to bed around 10:30 with Gordon. And before, with me having been sitting up at night, he gets up at 6, and I'd be dead to the world when he got up. He'd get up and go out, and I wouldn't even see him, you see.
Yeah.
But now, I wake up at 6 with him, and the four of us, the whole family has breakfast, and it's so different, We're more like a family.
Was it normal in bed, too? Was it normal?
Yes, and Gordon and I are more like man and wife again. I can't say that I've suddenly felt I've fallen in love with him again, but I do feel warmer towards him. I've been able to get through mountains of work I could never do before, and I don't even feel tired. And I'm still as cheerful and bright through it all. And with the kids, I'm in a good humor with them most of the time, and it surprises even me. I thought that Gail had been a little more contented the past few days, and this may be purely coincidence, but suddenly, right out of the blue at the weekend, she wanted to go to the bathroom. She wouldn't wet her pants. She just came to me and said, "Mommy, I want to go to the bathroom." You could have knocked me over with a feather.
The feeling that I had the last time was that it's important for you to express yourself.
I'm frank with him, very frank now. I mean, I even have told him about that I told you that I had no feeling.
That's right.
I'm not pretending it was easy to open up and tell him all this.
No, I know.
I had a few tries before I could get it out, you know.
Yeah.
And even when I said it, I was sort of crossing my fingers that he wouldn't, you know, thump me while I was saying it.
Yeah.
But I thought things couldn't have been much worse. I just thought, well, you know, I had to be frank with him, and it couldn't get much worse. And, you know, the way you and I talked, possibly this trouble is because I haven't spoken. So I just went ahead and I have told him. Mm-hmm. I said, well, do you understand? And you understand that I have to tell the doctor all this? And he said yes. And the more we talked, the better he understood it.
You know what's going to happen if you don't express yourself, don't you? I mean, this is just going to work inside of you.
Yes.
You'll be taking it out of yourself, which is the worst possible thing you could do.
That's what I was thinking.
Then you're going to get depressed.
So I thought, I'll just get it out of my system and just yell at him when he yells at me, you know. And a couple of times I did it at the weekend, and it blew over. And
I think that's the most natural thing to do.
Both of us have said what we wanted to say, and then one of us, or both of us, has made up. But it probably was only a couple of weeks ago that I said I didn't look into the future because I couldn't see anything. And yet now, I'm not trying to look into the future. I just naturally am thinking about the years to come.
So the impression, all in all, was that she was better.
Certainly sounds like it.
I must say that several weeks ago I didn't think this girl would really get better in this short a period. I thought that she was far too sick.
I don't think it would have worked if I'd seen this gal for the first time in the office, you know, just once, and said to her, be yourself. I mean, as Mickey put it, you just say be yourself, and she can't be herself. But after all, I have a lot of information about this woman, you know. I've gone through a lot of her experiences, more or less, with her. And I feel that this gal now is functioning in her family. That's the aim as far as I'm concerned in practice.
Isn't really what you achieved an ability to relate to her husband for the first time in perhaps in their whole marriage?
Yes.
So the thing that concerns us here is that you achieved a result, you're satisfied with the result, but much more important that you recognize what went into the achieving the result and how much of this you can use subsequently, because she'll be back.
No, I'm sure she'll be. I'm sure she'll be back.
We've reached the point at which, you know, perhaps we diverge in the handling of the patient.
Yeah, I think she's an intelligent girl, number one. So I think perhaps she's working through some of these things herself.
Well, no
Don't
question.
you? I mean, without
Yes,
me.
and then you can do some
Without
more.
me.
Yeah, but I assume
There's
that
an
you'll be
element of
back.
short-circuiting. Yeah. That's right. Nevertheless, it doesn't invalidate the result. Each individual in this state, except for the extremely dependent individuals, has a certain amount of frozen assets, frozen through depression. And that as you lift the depression, these assets are reinvested in other people. And this is the cure of depression, the reinvestment of libidinal, of love assets into other people.